Now I want you to imagine you come into the veterinary clinic. It's an average day, random Tuesday morning. You've got some surgeries coming in. Typically they start showing up at about 7 o'clock in the morning. You check them in, run blood work, things that need to be done, prepare for the surgery. The doctor comes in probably around 8:30 or so and the surgeries begin. As you're going through the surgeries, you and another technician, possibly a veterinary assistant as well, is helping rotate these animals. So we're getting them prepared for surgery as other people are getting the other animals recovered from the previous surgery. And you're just kind of going through your rotation like this. Get done around 11:30 noon and you take your break. And then appointments start at about 1 o'clock or 1:30 in the afternoon. Your first appointment comes in. The receptionist tells you that it's a recurring clinical case that's been coming in for the last couple years. You've never particularly seen this patient or client before, and so you grab the medical record and you start browsing through the medical record so you can get an idea of what's been done with this pet so far, what the problem is, how it's been treated, how it's been diagnosed, and what the next steps are, so you have an idea. The reason you can do that is because we keep medical records. And medical records play so many roles in the veterinary clinic that I don't have a clue what it would be like to work in a veterinary clinic without them, to be honest. So back in the 50 years ago or so, a physician named Dr. Lawrence Weed came up with the problem-oriented medical record, or POMR. And basically it's a way of tracking a patient's progress through diagnostic tests, treatments, cases, things of that sort, based on the problems that this patient has had. There's other forms of medical record keeping, but this is probably the most common that you'll see in the veterinary clinic. Within this problem-oriented medical record keeping, we make notes based on SOAP, subjective, objective, assessment, and plan. The subjective part is what the client tells us, what they're experiencing, what they're seeing. Now we're a space removed from from the human medical field, in the aspect that we don't know what the animal is feeling. We can only go on what we're observing and what the client is telling us. So it's subjective, right? And so the client tells us what's been going on. Is it getting better? Is it getting worse? Is the animal showing signs of pain, discomfort? What is the animal doing? That's the subjective. And then the objective is what we can basically measure. So respiratory rate, temperature, all your physiological parameters that we take, CRT, mucous membrane, weight of the animal, and then the diagnostic testing. So let's just say we're talking about, I'm trying to think of something, sorry, I can never come off the top of my head, but let's say that we're talking about a lameness case. So the initial exam is the client calls, or the client brings in its animal because, let's say it's a dog, because it's been limping. Okay, so the client tells us the dog's been limping. They think on the front right leg for the last 3 days. It's relatively acute. It just started happening. No known injuries or any reason that this should be happening, so forth and so on. So that's the subjective. And then you add in what you see too. Is the animal limping in your presence? Are you seeing front left leg? That kind of thing. And then the objective is when we start measuring. So we basically measure the animal's parameters, right, of course, and then we probably do some sort of rotation of, range of motion type measurements. Is the animal, literally gauging, is the animal showing a reflex to pull away when you touch the paw, that sort of thing. And then the veterinarian will do the assessment part. And so the veterinarian will come in and do an assessment and determine whether, and the objective is also diagnostic. So if we run radiographs or an MRI or an ultrasound, that kind of thing will go into the objective. And then the veterinarian will look at those radiographs at ultrasound and assess them. And then the plan is written out at that point. So let's say the veterinarian sees swelling in the tarsal joint of this front left leg. And so the veterinarian will measure how much swelling as best we can, give it some kind of measurement gauge so we can assess whether it's getting better later. And then the veterinarian will make a plan. And that plan might be rest for 3 weeks, maybe some anti-inflammatories, non-steroidal anti-inflammatories, and weight loss. Maybe this dog is a little overweight. So that's the plan. So we'll recheck in 3 weeks. Well, then 3 weeks later, you go in, you look at what the plan was 3 weeks prior, and you move on from that point. So that's the SOAP method, and it's the problem-oriented medical record keeping that SOAP fits into. So that's basically what we do for keeping track of an animal's progress. But we also use the medical records for so many other things, right? Let's say a dog comes into the clinic and it is very worried and it's very scared, and the veterinarian says, you know what, this is a typical well-pet exam. We don't think anything's wrong with this dog at this point. Why push this dog past its limit and capabilities of handling us touching it, and let's work on some behavior modification, educate the client, how can we do this, maybe some happy visits is the plan, and then the dog comes in, so forth and so on. Or maybe this dog actually snaps and tries to bite somebody. Well, then we're going to write in that medical record, this dog, use caution, this dog is very scared, this dog should wear a muzzle, and maybe the plan from that point on is the client puts the muzzle on in the dog before they even come into the clinic. They put it on out in the parking lot, and they walk the dog in already muzzled. I mean, things like that. So, and the reason that's so important is, obviously, you guys can figure this out, why that's important, to be able to communicate with each other when you're not present, right? It's virtual communication. But the other reason is for legal reasons. So if some reason the client comes back and says, you know what, my dog's never bitten anybody ever before, and you guys did something wrong to make this dog want to bite you, you have to have some kind of medical records to back up that you've noticed that this dog is terrified and so forth and so on. I've never been involved in a case where somebody tried to sue the clinic or the veterinarian, but I have been involved in cases where we've had unfortunate deaths, and it's not because of anything we did wrong. The client denied having pre-blood work done, potentially was one. So this dog had an underlying issue that we had no idea of. And it was a relatively routine procedure that we were doing. It wasn't something invasive. The dog appeared healthy, and the client just denied and said, no, I don't want to spend the extra, $80 or $100 on that pre-blood work. I think that we can take this tumor off or do this dental without it. And that also changes how the clinic works, because based on that case alone, that was very, very early on in my career, the veterinarian at that point would not do a dental unless pre-blood work was done. So it wasn't that we were negligible, but you learn from it as well. So there's legal reasons you want to keep medical records, and there's just efficient reasons why you want to keep medical records. We're currently going through, we're kind of past actually, but there's still some hanging ons. As you know, in school, we still use paper medical records. Obviously, most clinics at this point have electronic. A lot of clinics have electronic and paper. Part of that is because it's quick, right? It's really fast. You can grab that paper as you're walking out of the clinic and just quickly make your notations. So if Piggy's coming to see me, you might hear him. But you make your quick notations, but ultimately you're going to go inside and put that in electronically as well. So most veterinary clinics now have electronic form of medical record keeping, but they'll still have a paper form too. And there's multiple reasons why that might be. Another one would be pictures, right? Or you can have, you can take digital x-rays now, right? And you have them on file, and you can pull them up on the computer and look at them, but it's also very nice and simple, unless you have monitors specifically for, and some clinics do. I mean, we're changing, we're rotating quite a bit since I've been in practice. So many things have gotten so much more better and quicker. But you have these viewers in the rooms, right? It's nice to have a hard copy to put up there and show the client what you're seeing. And then the other part is just, I think it's hard, change is hard, right? It's just hard. I remember when I first started working in the third clinic that I worked in as a technician. And when I